This video is going to be about why we should get rid of Medicare and what we should replace it with. Our number one reason why we should make cuts to Medicare is to motivate it to fight fraud. So Medicare hardly pays any attention to which companies are cashing checks. There was an article where an ambulance companies charge Medicare in a blink of an eye for millions of dollars of taxi runs in a bankrupt Texas county. But this isn't the only place this is happening. It's happening all over the country, and it adds up, by some estimates, to a 20% drain on funds. So essentially, Medicare fraud would be easy to commit since programs pay cash within 14 days. However, it would be easy to stop if resources dried up. Our second reason to cut Medicare is because our entrepreneurs would be crowded out while it enriches less inspired entrepreneurs. Medicare only reimburses the less inspired entrepreneurs because they flip hospitals or start nursing homes. Why does Medicare do this? Because entrepreneurs create new technology that help people get out of nursing homes and hospitals faster. According to CMS's most recent survey, household health spending has gone down and government spending has gone up. So essentially, Medicare gets less money if entrepreneurs create new technology to help us get out of nursing homes and hospitals faster.
Our third reason for cutting Medicare is that it is unfair to young workers. When you buy private insurance, you assume that you'll get 80% or 90% back in the form of care. With Medicare, you'll get back anywhere from $2 to $6 for every $1 that you put in, but only after you retire. And if the program is discontinued by the time it's your time to collect, you get back nothing. The chances of Medicare dying out are high given how soon Medicare will run out of money. The current recipients are enjoying the fruits of the other workers' labors. Cutting current benefits increases the possibility of young workers collecting their benefits. Our fourth reason for wanting to cut Medicare is that Medicare rewards the bad. The program pays the same amount of money to a bad hospital or a doctor and the same amount to a good one. Imagine paying $600 to stay at a Super 8 and then paying the same amount to stay at the Ritz. How do such policies support innovation, customer service, or quality? Cutting Medicare will force it to make these unpopular but needed distinctions between the good hospitals and the bad hospitals. This also means that bad hospitals are being overpaid and good hospitals are being underpaid, making it unfair to the entirety of the healthcare system. Our fifth reason for wanting to cut Medicare is that Medicare is a fee-for-service model, meaning that the more services the hospitals provide, the more fees they can charge. This means that physicians and facilities have an incentive to do anything that can be justified as beneficial for each patient, sending a bill to the U.S. taxpayer each time. One extreme story had a former physician of an unconscious, dying elderly Florida woman visiting her room once a day to express his concern to the attending relatives, and each time billing Medicare for a doctor's visit.
Our final reason to cut Medicare is because Medicare's end-of-life care is immoral. Medicare gives a all-you-can-eat buffet to really old people, and some people decide not to spend their money and accept death, and some people decide not to accept their death and spend their money to keep themselves alive. And basically this leads to incomprehensible financial waste and human suffering as patients approach death. Taxpayers should not be paying for surgery, dialysis, and extended ICU stay for 90-year-olds who are on the brink of death. Clamping down on Medicare spending now makes it more likely that the program and the country will come to its senses on the issue at hand.
The best and really only solution to the Medicare problem is to privatize insurance. This involves signing on with an insurance company and then paying every month to have an insurance plan, which means that your company will provide a certain amount of monetary assistance every time you need care. This is a better model because it allows individuals to pay for their own insurance instead of relying on others' hard work to benefit themselves.